Americans are diagnosed with Parkinson's disease every year. Joining us today with the latest on Parkinson's disease is Dr. Nikita Urval, a neurologist with Hartford Healthcare St. Vincent's Medical Center. Doctor, welcome.
Thank you for having me.
Great to have you. So let's begin with, what is Parkinson's and is it easily diagnosed?
Sure. So Parkinson's disease is a disorder that affects specific cells in the brain that create a chemical called dopamine. And when you don't have enough dopamine, you can get symptoms like slowness, stiffness, tremor, trouble walking. And it's a disease that is diagnosed by a neurologist. And it's just something that's done in the office. There are tests that can kind of help support, but it's something that the doctor is able to diagnose.
And doctor, tell us, why is it important to detect Parkinson's early?
So because of the symptoms, the physical symptoms, it can make things harder in terms of your day-to-day activities, and especially things like walking and balance. We worry for people's safety. So getting ahead of it and finding it early just means that we can make sure that people are functioning the best that they're able to for as long as they can.
All right. Tell us about the course of treatment and what are the latest advances?
So treatment varies. The most important thing is exercise, but there are also medications to help treat the physical symptoms and other symptoms that come along with it, such as mood and sleep. And there are also surgical options as well. But the exciting thing is that there are more and more treatments being studied to help kind of stop or slow down the disease, as opposed to just treating the symptoms, which is what we have right now.
All right, doctor, and I understand that you're involved with some novel approaches designed to impact the Parkinson's community. This sounds very encouraging and hopeful. Tell us more about these approaches.
So our group is involved in a lot of clinical trials, looking at different approaches to treatment and new novel treatments. We're also trying to create a holistic center, kind of a multidisciplinary approach to treating Parkinson's, so that we're kind of a one-stop shop for everything that you need in terms of living your best quality of life.
And doctor, tell us about the basic symptoms in the time we have left. When should someone be concerned or see a doctor?
So the biggest thing that people notice is tremor or slowness in kind of your day-to-day activities. So if you're noticing that you are having to do things differently, or that you have a tremor that's kind of very noticeable or getting in the way of you doing things, you should bring it up to your doctor, because those can be some early signs.
All right, Hartford Healthcare's Dr. Nikita Urval, thank you very much for joining us and bringing us the very latest on Parkinson's. We appreciate it.